Just to be more clear for the listeners, like what types of services are these VAs offering? Because obviously, if you're delivering medications or doing, physician type work, you have to have that license in that particular state. But these are doing sort of ancillary services, it appears to be. Can you fill us in on that?
Right. Yeah.
So Beth, welcome to the show. It's a real pleasure to have you.
Yeah, thank you so much for having me. I'm so excited to be here.
Yes. Looking forward to diving into our conversation. Looks like you're doing a lot of exciting things. I love getting the show started off first, though, by having our guests tell us a little bit about what it was like being them growing up and sort of paint the picture for us. How did Beth get to become the CEO?
Yeah, interesting. Well, so painting the picture of me, interesting. So from childhood up, I was a gymnast. I was an elite athlete, an elite gymnast. So I trained many hours every week since I was a small child. So ultimately got a full scholarship to the University of Florida as to be a gymnast at the University of Florida. And I entered the corporate world after I left college. I entered the corporate world in the medical industry. So pharmaceuticals, surgical supplies, surgical implants. And then ultimately, and I loved what I did. I was in the operating room for years selling surgical devices in the operating room. Spent quite a bit of my career in medical practices across the country, medical practices, especially in the Northeast, because that's where I was located. And I paid close attention to what was happening in each practice and kind of see where I would be of value as, to help the practice whenever I was there or to get out of the way if I needed to get out of the way, right? Because things are really busy in the medical practices. But I paid very close attention. But ultimately, what led me to be the CEO of REVA Global Medical is my husband was going through a partnership breakup. He had started a virtual assistant company years previously. So he's had a VA company for, going in the 9th year now. And he was going through a business partnership breakup 4 years ago. And I quit my job and immediately joined my husband and we launched REVA Global. And within a couple of months of launching REVA Global, I just knew that there was a great business that would be for offering medical virtual assistants to medical practices. Having had paid attention in those practices, I knew that medical virtual assistants would really be able to help and would have a great spot in all different areas within hospitals and or medical practices. So I launched REVA Global Medical and it has totally taken off. It's been an amazing endeavor. It's been incredible. I have an amazing team and everyone that works here at REVA Global Medical is truly incredible. All of our medical virtual assistants are they're just really, really great at their job. Very, very professional, excellent with patient care, excellent with handling day-to-day tasks that have been delegated to them. And so it just was like this natural thing that kind of happened. And it has been amazing. It's been an amazing ride.
Yeah, awesome. Sounds like it. Pretty cool that you were in gymnastics. My wife was actually in gymnastics as well. She trained at DEVA in Romania, where Nadia Comaneci trained.
Nice.
She did the different gymnastics though. She did aerobic gymnastics. Okay. Like when you're super young, you get to pick your path, whether you're doing the vaults and stuff, or you go or aerobic. So aerobic is like huge in Europe, not so huge in like the Olympics in here.
Yep.
Whereas the other one. What's the other one? Is there like a name for the other one? Out of curiosity.
So I was in artistic gymnastics, and then there's rhythmic gymnastics. Okay. So there's different
styles,
types,
techniques. Yeah. Cool. When you're at UF, what did you study there?
Yeah, great question. So I ended up going into the College of Health and Human Performance, and I was in health sciences. So, I knew I wanted to be in the medical industry, and ultimately my plan was to be in the operating room. Always. That was always my plan, is to be in the OR, whether I was a nurse in the OR. I just wanted my hands in the thick of things. And so ultimately, because clinical hours and a lot of the hours for, on the medical piece at University of Florida, we're going to be during practice time, and I was on a full scholarship for athletics, I had to change my major, which was fine. I did that. And because I'd already done all the prerequisites on the health side with the health sciences, it was just a natural progression. So that's what I ultimately graduated with.
Cool. And then surgical medical supplies, like that's an awesome field to get into. We watch the sales reps all the time because I do anesthesia, or haven't done it in almost a year now, which seems crazy. But yeah, it's you guys have a good job. You get paid extremely well. So I can't imagine what were you going through when when you left that job?
Yeah. Oh, it was a big transition. It was a really big transition. Leaving my surgical device job was a big decision, but I had to make it quick. I mean, it was a quick decision I needed to make in order to join forces with my husband and make it happen. So, it's different when, I had my own career. My husband has always been an entrepreneur. I've always been the one that's like, okay, I'm a corporate person. I have a job. I'm getting paid. With both of us jumping in, head first, like really, truly jumping in, both of us, there was a lot of pressure to make sure we were successful. Yeah. Yeah.
Well, sometimes that pressure is really good though, right? Like, there's that saying, like, if you want to take the island, you got to burn the boats. Kind of burn the boats. I guess you could always go back, but that pressure really.
The boats. Oh yeah, we burned the boats. Yeah. So so the pressure's on, right? And both my husband and I were both Division I athletes. He also played professional hockey, and we're used to being under a tremendous amount of pressure and having to excel under pressure. And so, so it just, we tend to thrive under a tremendous amount of pressure.
Yes. Athletes have that trait. I know that for sure, which is awesome. Would you do that again? Would you quit your job and immediately jump into a business? Would you do that same strategy again if you could go back and redo it?
Yes, absolutely. Yep. The people that were working closely with my husband from day one, I completely, totally impressed with their level of professionalism and just how incredibly bright and smart they are and just absolute go-getters. I mean, I've worked at some really big corporations here in the US, and I was so incredibly impressed with our team. I mean, our team is just top-notch. So I kind of felt like I can't imagine doing it any other way.
Yeah. And going through a partnership breakup, that's it's kind of like going through a divorce. It's a big deal, right? Yeah.
Yes.
Can you elaborate just a little bit on like what that process was like? Like what happened to the previous business? Were you allowed to take some of the staff? Did you just split it up? Did you sell it? What happened in that situation?
Yeah, great. Yeah, it was sudden, and it was just one of those things where we just had to immediately dive in and try to do the best we can to recover and take the staff that would want to stay, and the staff that didn't want to stay left. And so it was a tough time. It is. It's like a divorce. You're never really sure how you're going to react in a situation like that. And it's easy to be reactionary and to have, bad feelings and do the gut wrenching piece of trying to go through lawyers and all of that. And then, ultimately, you just kind of grab your bootstraps and it's like, okay, no, it's just time to get back to work. Like we just need to move forward and push forward without the other partner and just do it. And so that's pretty much what we did. We just focused on us and focused moving forward and didn't really listen to the noise or listen to what was happening on the other side. We just needed to just continue to push forward in the direction that we wanted our company to go in.
Yeah, that's great. Do you have any advice for anybody who is considering a partnership and, maybe some things that they should be, more concerned about or sort of, make sure that are in their contracts and things like that?
Yes. I would say date if possible before you get married. Really, really know the person you're going into business with. Learn their history. How are they with their spouse? How are they with their children? How are they with, their, even their college roommate, right? Like how you live with someone and how you react like in those scenarios can really define the path forward. So if someone has a difficult time committing, if they've already been through 2 divorces, if they're, they have a wandering eye, you got to know, okay, like if there's shiny object syndrome, that's not the person you want to go into business with, right? You want someone who's going to be really honed in on the business together. And then the other advice I would give is make sure that you have an exit strategy already put in place if things don't work out. So you need to have those conversations before you go into business partnership with someone and say, okay, so let's say if this doesn't work out, what are we going to do? And have that all in your operating agreement and like your divorce agreement, if you will, on how it's going to go if things don't go well. there's life changes, people, move, they want to establish a new life in a different part of the country. Well, where does that leave your partnership with your partner? There's all kinds of things that happen. What happens if there's someone that gets ill and they ultimately can't work in the business anymore? So where is that going to leave you as a partnership? So have all of those things lined out first. And have that in a contract so that you know what the exit strategies and how things are going to go if those things go wrong. Yeah,
really, really good advice. There's this quote that JLD has, and I'm racking my brain for it because it's a perfect one. It's something about ships, and all ships float or something besides partnerships. He hates partnerships. But it was a really funny one. I'm gonna grab it and find out where he put that. He posted it somewhere. I was like, that's a great quote. But that's not totally true. I mean, if you prepare, if you plan, if you date ahead of time, like partnerships can be phenomenal. At the same time. You just got to do them the right way. Just like
absolutely.
You said. Yeah. So your business idea is phenomenal, by the way. And so it's very clear to see why you guys are crushing it. Business model plus your guys' skill set and track record in the past, and that elite athletic drive, I'm sure helps a lot too. So medical VAs, I mean, this is awesome, right? This is a massively important service for those that run medical practices or healthcare service organizations, because they can do a lot of stuff, right? So talk about that a little bit.
Yeah, let's talk about it. Well, let's talk about, if we can just talk about the timing of this. Virtual assistants have been widely used in all different industries, but the medical industry is behind the eight ball. We just haven't jumped in it. We haven't embraced it. And so ultimately the timing of when I started and launched REVA Medical, the timing was perfect. It was really before a lot of information was out there about medical virtual assistants. And so it gave me the time to be able to scale the way I needed to scale, slowly and steadily, to make sure I built the infrastructure correctly. And I kind of got, all the kinks worked out first. And then the pandemic happened. And it all of a sudden became really clear to the medical industry that remote workers in medicine is possible. And that was something that was not really, that was a really tough thing. And all the sales calls that I did previous to the pandemic, I really, really had to sell hard. I mean, those sales calls were some of the most difficult sales calls I've ever done, as trying to really try to explain just how it can possibly work and how well it works. Now my sales calls aren't at all like that. It's really about, what are the pain points in your business? Let's strategize on how to get somebody up and running, or within different departments very quickly, and try to get the practice up and running with medical virtual assistants efficiently and get them going. And so it's such a different strategy call that I'm having with clients. It's just so incredibly different. But the timing of this is it couldn't be any better. We now all know remote is possible, and it's possible to do it extraordinarily well. And so with that, here comes, REVA Global Medical into a number of practices across the country, a number of hospitals across the country. And it's been an amazing endeavor.
Yeah, for sure. And so just to be more clear for the listeners, what types of services are these VAs offering? Because obviously, if you're delivering medications or doing, physician type work, you have to have that license in that particular state. But these are doing sort of ancillary services, it appears to be. Can you fill us in on that?
Right. Yeah. I mean, so anything from the front desk, right? So answering phones, triaging calls, being able to set patient appointments, canceling appointments, you name it. You can have a virtual receptionist, if you will. So if you have an extraordinarily busy practice and you just don't have the physical space to add any more people at your front desk, but you still are you're struggling with the day-to-day of not being able to handle the number of phone calls coming in. The phone tree is a nightmare. There's people being dumped into different parts of the phone tree and then leaving messages and no one gets back to them, and then patient complaints. So there is a way to be able to immediately bring in medical virtual assistants to help just with the phones and managing patients as they're calling in, handling questions and being able to answer those questions, so you're not bothering the medical staff. So there's that piece, right? So that's just the front desk, that virtual front receptionist person, to full new patient intakes. New patient intakes in specialty practices are extraordinarily time consuming, and it's typically the front desk person that's doing that, or the people at the front desk. So you're taking those people from the front desk away from handling live patients in front of them, checking patients in, managing the phones, because they're on a 15-minute call doing a new patient intake. All of that can be delegated and done and sent to a medical virtual assistant. So that's, some of that. So then you can go into like different departments of like, faxes are coming in like crazy. They all need to be, they need to be logged. They need to then be categorized, and they need to be put into the EMR and tagged with that particular patient, or sent to a particular person within the practice. In some of these really busy big practices, there could be 20 physicians, and there's, so many faxes coming in on different patients, lab results, you name it. And so all of that needs to be categorized and dealt with. So a VA can also manage that. So that's just like some of those things. Then there's like insurance verifications, prior authorizations, like prescription prior authorizations. So incredibly time consuming for your onshore in-office staff. Your medical assistants, nurses should not be on the phone sitting, waiting to get an authorization for a procedure. That can be absolutely delegated and handed off to a medical virtual assistant. Get your nurses and your medical assistants doing patient care, truly assisting the physicians in the practice, and not sitting at a desk, spending an hour and a half trying to get a prior authorization or an insurance verification. So all eligibility checks, all of that can all be handed off to a medical virtual assistant. Then the big piece that goes beyond that is revenue cycle. So claims, billing, collections, denials, all of that also could be managed by a medical virtual assistant or a team of medical virtual assistants. So there's so many different things that can be done. You can go into each department, and there's a way to use a virtual assistant clinically and administratively. There's different ways you can use a medical VA.